6-mercaptopurine is the purine analog and it exerts its anti-leukemic effect by penetrating the target cell and converting to nucleotide analog 6-mercaptopurine ribose phosphate or 6-thioadenosinic acid. Then it inhibits purines in biosynthesis and thus inhibiting the formation of a functional RNA and DNA. Its oral absorption is erratic, but it distributes in all tissue but does not cross blood-brain barrier. Adverse effects of 6-mercaptopurine include nausea, vomiting, diarrhea, myelosuppression, anorexia, and hepatotoxicity. Allopurinol, which is a drug used in the treatment of gout, it can, if used concomitantly with 6-mercaptopurine, can increase the concentration of mercaptopurine as it inhibits xanthine oxidase enzyme required for the metabolism of 6-mercaptopurine. Then 5-fluorouracil or 5-FU is a pyrimidine analog. It has a stable fluorine atom in place of a hydrogen atom in 5 position of uracil ring. Itself 5-FU is devoid of antineoplastic activity, but it enters the cell through a carrier-mediated transport system and is converted to 5-FDUMP, 5-fluorodeoxyuridine monophosphate, which inhibits thymidylate synthase enzyme, thus blocking the synthesis of thymidine base. In turn, DNA is not formed and rapidly dividing cells die. It is given intravenously as it produces GI toxicity. Dose modification is required in hepatic impaired patients. The hydropyrimidine hydrogenase levels should be monitored when 5-FU is given. Adverse effects of 5-fluorouracil include diarrhea, alopecia, mucositis, hand-foot syndrome, and coronary vasospasm. It is used in a regime used to treat advanced colorectal cancer and also slowly growing solid tumors like tumor of breast, ovaries, and pancreatic cancer. And antibiotics that are used in the treatment of cancer are doxorubicin is also known as this doxorubicin belongs to a class of anthracyclines. Um, Doxorubicin is also called erythromycin, which is a renowned brand name of doxorubicin. These anthracycline antibiotics induce cytotoxicity through several different mechanisms, like free radicals formation, which can lead to lipid oxidation of cell membrane, and then scission or cutting of DNA strand, or direct oxidation of purine and pyrimidine bases thiolenamines. It is administered intravenously. Dose adjustment are required in hepatic patients. This doxorubicin does not penetrate testis and blood-brain barrier. Adverse effects. Most serious adverse effect of doxorubicin is irreversible cardiotoxicity. So it is given with a iron chelator dextrazone, which reduces this toxicity. Veins become red due to its color, and red urine is passed. Nausea, vomiting, diarrhea, and alopecia are also side effects of doxorubicin. It interacts when it is given with trastuzumab, which is a monoclonal antibody. It increases the risk of congestive heart failure (CHF). Then bleomycin. Bleomycin is a mixture of different copper chelating glycopeptides. It is cell cycle specific and causes cells to accumulate in the G2 phase. It is used primarily in the treatment of testicular cancers and Hodgkin's lymphoma. It it forms a complex with DNA and Paris molecule, and um, the DNA is oxidized, and hydroxyl radicals are formed, which tag the phosphodiester bonds of DNA, resulting in strand breakage and chromosomal aberrations. अच्छा इसका जो most serious adverse effect है, it is pulmonary fibrosis, and like other chemotherapeutic agents, it can cause alopecia. Also, it causes hyperpigmentation of hands and foot, fever, chills, nausea, vomiting, diarrhea. It can be administered through IV, subcutaneous, and iron route. And then next class is alkylating agents. Cyclophosphamide is a drug which belongs to alkylating agents. These alkylating agents exert their cytotoxic effect by covalently binding to nucleophilic groups on various cell constituents. Usually, the alkylation of DNA is cytotoxic step and lethal for tumor cells. These alkylating agents do not distinguish between cycling and resting cells, but they are more toxic to rapidly dividing cells. Cyclophosphamide, after hydroxylation by cytochrome P450 in liver, activates to form its metabolite phosphoramide, mustard, and acrolein. This first metabolite, the former metabolite, is cytotoxic, and this acrolein is cytotoxic for bladder, urinary bladder. Um, this drug is used to treat non-Hodgkin's lymphoma, sarcoma, and breast cancer in a regime form. It is a part of a regime in these conditions. Then adverse effects of cyclophosphamide. A major adverse effect is hemorrhagic cystitis and fibrosis of the bladder, which is due to the formation of acrolein metabolite. It also causes nausea, vomiting, diarrhea. To reduce this side effect, adequate hydration and intravenous mesna preparation is given to the patient on cyclophosphamide therapy. This mesna neutralizes toxic metabolite acrolein, and mesna is given on after some hours before the treatment and after some hours of the treatment to prevent this hemorrhagic cystitis and fibrosis of the bladder. Then temozolomide. This is another chelating agent. Thing which is unique to this drug is that it can be used for the treatment of tumors in the brain, which is particularly difficult. This drug undergoes biotransformation and it forms methyl triazolidazole carbamide (MTIC), which causes methylation of DNA on the sixth position of guanine base. It is indicated for the treatment of glioblastoma, brain tumors, and metastatic melanoma. It crosses blood-brain barrier. It can be administered IV or it can be given orally as well. Adverse effects of this temozolomide include nausea, vomiting, myelosuppression, fatigue, headache, and photosensitivity. Then microtubule inhibitors. Microtubule formation, as we know, is a part of cell division, and mitotic spindle is a part of intracellular skeleton, cytoskeleton, and it is essential for the movements of structure in all eukaryotic cells. And this mitotic spindle is formed due to microtubule formation, and it will be inhibited, cell division will be inhibited. So vincristine is a microtubule inhibitor. It inhibits anaphase of mitosis by blocking polymerization of tubulin molecules. Tubulin molecules are polymerized to form a spindle, then they are depolymerized and form two, you can say, two chromosome, two cells divide हो जाते हैं. One cell is divided into two by separation of chromosomes due to the formation of mitotic spindle. This is vincristine is used in R-CHOP regime for lymphoma and other rapidly dividing tumors. Adverse effects of this vincristine is neurotoxicity and constipation. This vincristine is derived from a plant called Vinca rosea. It is basically an alkaloid. Then paclitaxel is another microtubule inhibitor which renders the microtubule to depolymerize in late metaphase, thus inhibiting the division of cell. This is active in G2 or M phase of cell cycle. It is a first member of taxane family to be used in cancer chemotherapy, and it is also derived from a plant specific use. This is indicated in treatment of advanced ovarian cancer and metastatic breast cancer. Adverse effects of paclitaxel include neutropenia, leukopenia, alopecia, and hypersensitivity reactions. Then another class of anti-cancer agents is steroid hormones and their antagonist. Um, Tamoxifen is a estrogen antagonist and it has some estrogenic activity as well. It is used as first line therapy in treatment of estrogen receptor positive breast cancer and also for the prevention of this breast cancer. It is given in long term. It binds to estrogen receptor in the breast tissue, but the formed complex is unable to translocate in nucleus for initiating transcription. RNA synthesis does not occur, which results in downregulation of estrogen receptors and growth promoting effects of natural hormone are suppressed. It is orally absorbed, available in the form of tablets. Uh, Adverse effects of this drug are same as experienced by inhibition of estrogen like hot flushes, vaginal bleeding, hypercalcemia. Then aromatase inhibitors, example is letrozole. It inhibits aromatase enzyme which is responsible for the conversion of androstenedione to estrogen in peripheral tissues like liver, fat, muscle, skin, and breast tissues. This peripheral aromatization is an important source of estrogen in postmenopausal women. So it is used to prevent the risk for endometrial cancer in the women who have a family history of this cancer or breast cancer को prevent करने के लिए भी ये drug use होती है. Adverse effects of letrozole are hot flushes, joint pain, ischemic cardiovascular events, osteoporosis. This drug is often given to induce ovulation in women who have an unexplained infertility. Then platinum complexes, example is cisplatin. Cisplatin mechanism of action is same as alkylating agents. It binds to guanine base in DNA and um, causes cytotoxicity of the cell by inhibiting DNA replication and RNA synthesis. For this drug, cytotoxicity can occur in any phase of the cell, but it is most active on cells in G1 and S phase. Cisplatin adverse effects are severe vomiting, which occurs at least after 1 hour and lasts for 5 days. The most severe effect of this drug cisplatin is nephrotoxicity. So it requires pre-medication and anti-emetic agents. Almost all anti-cancerous agents require pre-medication with anti-emetic agents, corticosteroids, and you can say proton pump inhibitor as they cause GI toxicity, and also anti-allergic because they cause allergies, and some drugs are given with leucovorin uh, because they cause myelosuppression. And other adverse effects are ototoxicity, hypersensitivity, and nausea and vomiting. Then topoisomerase inhibitors include etoposide, which targets topoisomerase enzyme and causes irreversible breakage of double helical strand of DNA in late S to G2 phase. It is indicated in the treatment of lung cancer and testicular carcinoma, along with bleomycin and cisplatin. Adverse effects Main adverse effects include myelosuppression, also causes hypotension, alopecia, nausea, vomiting. It can be given intravenously or can be given orally. Then another class, tyrosine kinase inhibitors. Tyrosine kinase inhibitors inhibit tyrosine kinases, which are an important enzyme for signaling signal transduction between cells and for cell division, specifically in tumor cells. Examples include imatinib, dasatinib, nilotinib, erlotinib, sorafenib, and sunitinib. Imatinib and nilotinib is used for the treatment of chronic myelogenous leukemia (CML). The adverse effect they cause is fluid retention, QT prolongation, and ECG. Erlotinib inhibits EGFR tyrokinase, and it is used for the treatment of non-small cell lung cancer and pancreatic cancer. It causes nausea, diarrhea, acne-like rash, and ocular disorders. Monoclonal antibodies or hybridoma technique. Monoclonal antibodies are created by the fusion of specific antigens, which are present on different tumor cells, with B lymphocyte tumor cells, those which are immortal and rapidly dividing plasma cells in result of this fusion. hybrid cells or hybridoma are produced, which can be cloned, and each clone will produce antibody directed towards the single antigen type which was used to create these hybridomas. Um, in previously, these monoclonal antibodies were formed by taking antigens from animals and mice and animals like horse, sheep. So they were prone to produce side effects, but now they are humanized. They are cell specific as they act on a specific tumor cells or so they have lesser side effects, but they are very much expensive as well. They find application in numerous other autoimmune disorders like rheumatoid arthritis, inflammatory bowel disease, and psoriasis. Trastuzumab, it is a monoclonal antibody or mAb which inhibits human epidermal growth factor receptor protein, and it is used in the treatment of breast cancer. It can cause congestive heart failure, so it should be given with caution with adriamycin. Rituximab is another monoclonal antibody and it targets CD20 antigen which is present on B lymphocytes or plasma cells. This rituximab targets the CD20 antigen. This antigen is present on both normal B lymphocytes and tumor B lymphocytes. So this is used in the treatment of non-Hodgkin's B cell lymphoma. Also, it is used in the treatment of rheumatoid arthritis as it destroys B cells which cause destruction of joint cells. Then other miscellaneous drugs used to treat cancer include L-asparagine. L-asparagine is basically an enzyme which converts asparagine to aspartic acid. Researchers show that there are many tumor cells which cannot synthesize asparagine amino acid which is used for protein synthesis. So when this L-asparagine is given, the asparagine is converted to aspartic acid and is not available for protein synthesis. So division of tumor cells is inhibited. Normal cells can synthesize asparagine and thalidomide which is used in the treatment of metastatic castrate-resistant prostate cancer. This is all about anti-cancer drugs. If you have any question regarding it, you can ask on WhatsApp group or on G Classroom. Thank you, class.